Welcome back. By now, we know if you get a sore throat or a cough, we need to get a COVID test. And that test should not cost you a dime. It's covered under the CARES Act.
But as consumer investigator Kristen Byrne shows us, how your doctor's visit is billed can change that unless you speak up.
About a month ago, Joe Burke of Waukesha had a sore throat and some body aches. And around the same time, he says a friend of his, who he was around, was sick too and was going to get a COVID test. So Burke did the same.
Obviously thought it was important. I have 2 young daughters.
With an upcoming vacation, he didn't want to wait for an appointment at his doctor's office. He wanted results fast, so he decided to go to this urgent care in Oconomowoc.
With my symptoms, they felt it best to give me the COVID test.
Medical staff there encouraged him to stay home.
Their advice was very clear. Quarantine yourself for 14 days. The test will come back, but until then, you have to be proactive and protect yourself and protect your family. So the entire visit was COVID related.
2 days later, his COVID results came back negative. And then this bill arrived in the mail from his medical provider, Aurora. It was for $267.88.
I was just about to pay it, but the more I thought about it, I just felt like I was pretty sure that was covered under the CARES Act.
He's right. The CARES Act requires health insurance plans cover testing needed to detect or diagnose COVID-19. He learned his provider billed him using the medical codes for pain unspecified and for acute pharyngitis or a sore throat, even though his visit was strictly for a COVID test.
In my mind, you would think that this is a common bill. There's a bunch of people just like me going in for these kind of tests. The coding should be pretty repetitive.
The I-team reached out to both Aurora and United Healthcare. A spokesperson for Aurora told us in part, quote, "In our urgent care settings, patients are first evaluated by a provider who determines if they need to be tested for COVID-19. Patients' insurance may be billed for costs associated with that evaluation and visit." And that, quote, "It is our practice to work with patients regarding these types of complaints in an attempt to resolve their concerns." A spokesperson for United Healthcare said in part, "The claim has been reviewed and he will have no member responsibility," meaning Joe Burke doesn't have to pay this bill. Could you have done anything differently, or would you have done anything differently?
No, I don't think so. Like I said, it was pretty cut and dry. When you get a medical bill, you really expect it to be accurate.
If you find yourself in a situation where you get sick and you need a COVID test, clearly state to your nurse or doctor you think you have COVID-19. If you do receive a bill, check your explanation of benefits and make sure your service code is accurate. And if it's not, don't agree to pay it until your provider corrects it. For the I-team, I'm Kristen Byrne.